reporting high COVID activity levels in recent weeks. And according to the CDC, nearly 40 states are reporting high COVID activity levels, and emergency room visits are at their highest for the coronavirus since February. So where does North Carolina stack up?
Well, we've had our Jason Puckett looking at those numbers. So Jason, how are things in our state right now?
Well, I have spoken with multiple health agencies today, including the North Carolina Department of Health. Bottom line, cases are increasing across the state, including at hospitals like this, but it's not always easy to measure. Comments like these are popping up across social media with claims that COVID strains are increasing in the area, but is that true? Well, according to the North Carolina Department of Health and Human Services, yes. They sent us this statement saying in part that they have seen increases in COVID metrics across the state, including an increase in cases at emergency departments. The biggest change in COVID numbers was detected in wastewater samples across the state. DHHS charts show they detected almost twice as many virus particles in the wastewater as the previous week. The CDC shows similar numbers, showing North Carolina as having a, quote, very high viral activity level. So what does this mean for you? Should we be going back to wearing masks? Well, not exactly. The DHHS acknowledges that, quote, we are in a different place with COVID-19 than we were during the pandemic, and gave 3 precautions to take. 1, practice good hygiene and make sure not to cough or sneeze around others. 2, stay home and try to quarantine if you're actively sick. And 3, finally, if you are actively sick, then you can consider wearing a mask and other prevention strategies for at least 5 days after testing negative. And of course, the CDC and the state health department both still recommend taking the COVID vaccine. They say it's the best way to reduce serious complications from the virus. Jason Puckett, WBTV, on your side.
All right, Jason.